By far the most common question when it comes to ankle sprains is how long does it take to recover from a sprained ankle? And of course, in my profession, it really does alter your lifestyle. Depending on how severe it is, getting from point A to point B is difficult, arduous, from getting to work, taking the kids to school. So patients want to know how long and how far do I have to go, staying off it, et cetera, et cetera. And the best way to answer that question is with testing and classification. So let's start with a grade 1. And a grade 1 sprain is your usual inversion sprain or eversion sprain, sometimes even plantar flexion or dorsiflexion. And those are just a tugging or a strain of the ligament or tendon, and those will turn the corner somewhere around 72 hours. They really don't go longer than a week, and then you can start back to the gym, test it a little bit, some side-to-side motions. Grade 2 is a partial tear, and of course, that's more severe if it's just a few strands, 25%, 50% tear. Those amounts of tears, of course, will a tendon or ligament mend on its own. And non-weight bearing or walking in a cam walker, sometimes crutches, these will mend back together around 3 weeks. And then you can start touching down. Tensile strength, which we call pulling on the ligament or tendon, that's around 4 to 6 weeks. And then you can start to get on it even more, some light exercises or light physical therapy. And then you can get back into the gym and then some side-to-side activities. Grade 3 is a complete tear or rupture. Sometimes those require a surgical fix, but even if it's just being placed in a cast or with some of the lateral collateral ligaments, if they're still kind of hanging on by a few strings, you can dorsiflex the foot or evert it into a boot. And for some non-athletes, it's the treatment of choice. Those again take about 3 to 4 weeks to glue it back together, if you will, but the tensile strength and straining that won't really happen until 6 weeks to 8 weeks. And then again, some physical therapy, some stretching, and some strength training. Again, hopefully that was helpful. If you would like to see more videos, you can log on to my personal YouTube channel, which is Dr. Robert J. Moore III. There you can even see live surgeries. If you don't like what you saw, you can want to ask your own question. You can put it in the comments area, and I'll do my best to get to those.